Well, Dr. Samuel, you talked about the 6-month smile where you do orthodontic work literally in 6 months instead of the usual 1.5 to 2 years, and get wonderful results, sometimes even faster than 6 months. Now, there's also this thing called Invisalign braces, which are not wired. When do they have a use?
Invisalign is a great alternative to comprehensive orthodontics. As I mentioned in the last video, comprehensive ortho involves 2 years of metal braces. The Invisalign is a great alternative because, for one, it's cosmetic, so a lot of adults who don't want to wear braces and they don't want the unsightly metal braces, you can wear these little plastic covers, they're called aligners, that slide on over the teeth. If anyone's ever seen any bleaching trays, they're actually even thinner and clearer than bleaching trays. So they're barely visible. So they do a great thing cosmetically if you want to move teeth. But there are some more difficult things about Invisalign that braces can do and Invisalign can't. Invisalign can only do certain types of movements. It can tip teeth. Can't really bodily move teeth. Invisalign, although it moves teeth, in most cases it takes a little more than a year, so it's quicker than full comprehensive orthodontics. The one problem that I see with Invisalign is compliance, because patients have the ability to take these things out, these aligners out. They're instructed to wear them 24/7 with the exception of when eating. However, so many people keep them out when they go out at night. Sometimes when they're on the phone, they don't like to wear them. So you're not getting the movement for the long period of time that you need to really get the Invisalign to do its job. So that's one of the drawbacks of it.
I see. That's why I think originally they mainly made them for adults, because adults supposedly are more compliant, versus a small 14-year-old might, put them away at lunchtime and run away and even lose them, maybe.
Well, that has happened, yes.
I'm sure
that's true.
I'm sure it does. But so if a person nevertheless complies, then they're a very great way of straightening out your teeth, as long as the dentist still feels it's doable, because it's not major strong movements, which you might call, I think, comprehensive orthodontal work, right?
That's correct.
Yeah. So wonderful. And so they're really kind of invisible. You said that they, at normal speaking distance, you really kind of can't see them.
That's correct. I mean, they look great. There's nothing like them in orthodontics. Even 6-month smiles, which I love to do, they're real braces, and it's hard to hide those brackets completely. But with Invisalign, they're very thin, they're very clear, and they just slide on over the teeth. And unless you're really looking for them, they're really not noticeable. So that's their biggest advantage.
Right. And you said that people take them out while eating, which I guess avoids the spinach on the flagpole next to the, around the teeth in the back or somewhere, right?
Well, that's right.
So people can floss their teeth. Not necessarily. Well, they should maybe, but they can brush their teeth after eating, and thus, because I've heard that people with braces, they keep them on for 2 years, and again, flossing and brushing becomes a little more difficult. So if then you run into a slightly more sloppy guy, he might neglect it a little bit, and by doing so, actually develop some sort of gum disease, which in itself has its own problems, right?
Oh, yes, for sure. I mean, any type of braces, it's very difficult to keep things clean. You have to work extra hard at it. With Invisalign, at least you can take out the aligners and you can brush and floss normally. But wearing the Invisalign aligners also creates plaque retention. So that has some negative effects as well. So any type of orthodontics requires extra care to make sure that you don't develop any type of gum disease.
I bet it does, which of course makes the thing you talked about in the other video about the 6-month smile wonderful, because at least you only have to go through this ordeal for 6 months.
Which is one of the reasons why I love that technique so much. It works incredibly well.
I can see why, and I'm sure your patients do too, don't they?
They do. They do.
All right. Dr. Samuels, very informative. Thanks a lot.
All right. Thank you.